Welcome, everyone. Thank you for joining us for today's presentation, Burnout Self-Assessment Tools. My name is Diane Fabi King, and I am the Senior Advisor in the Division of the National Health Service Corps in the Bureau of Health Workforce at Health and Resources and Services Administration, otherwise known as HRSA. This is the sixth webinar we've had in 2024 on the National Health Service Corps Empowerment Initiative, and this one is Advancing Clinician Wellness and Health Equity. I'd like to share a little bit of information about this initiative that we have for you today and others. This initiative was designed to help NHSC participants and our new clinicians in the field prepare for the rewarding and what we think challenging experience of serving in health professional shortage areas. We're so thankful for those of you who have been attending and those who are attending today, taking advantages of our resources. As part of this initiative, we have also designed some of our webinar series and resources for the leadership and administrative staff at our NHSC approved sites. You all have the opportunity to greatly influence the culture, the work environment, and of course, organizational policies and practices that can lead to improved clinician wellness. We're so happy to see so many of you joining our webinars over and over again to learn more about how to support NHSC clinicians. And we can't do this important work without you all. We hope you enjoy this webinar and share the recording with your colleagues who could not make it today. I'll hand the mic to Sabrina now for us to get started. Thank you so much for being here.
Thank you, Diane, and good afternoon, everyone, and welcome to our webinar, Burnout Self-Assessment Tools. My name is Sabrina Edgington. I'm the Senior Director of Justice, Equity, Diversity, and Inclusion Initiatives at the Association of Clinicians for the Underserved, and I'll be serving as your moderator today. So just a quick note, if you missed it earlier, you can open up your chat box manually on the bottom right-hand corner of your screen by clicking on the little chat icon. Feel free to use that for any questions or just to chat and comment with each other. We're really excited that you're here joining us today to learn more about burnout assessment tools. Some of you may know that this past Monday, March 18th, was the inaugural Health Workforce Wellbeing Day, established by the National Academies of Medicine and their partners at the Clinician Wellbeing Collaborative. And we're excited to be part of the many initiatives that are working together to improve conditions for healthcare workers and to support their well-being. Our NHSC Empowerment Initiative is especially concerned about clinician well-being because we know that NHSC participants work in under-resourced communities and work with patients that experience barriers to care, which can make clinical work stressful and challenging. We want to ensure that NHSC-approved sites are able to minimize workplace stressors so that NHSC participants feel safe, supported, and energized to practice at their highest capacities. While we want clinicians to be active in protecting their own well-being, we know that burnout is a workplace phenomenon, often stemming from unresolved issues at the organizational level. During our next webinar on April 10th, we'll discuss ways that organizations can monitor and address burnout at that higher level. And during the summer, we'll have more in-depth presentations on what practices and policies organizations can implement to best support clinician wellness and foster organizational resilience. Today, our focus is going to be on how individual clinicians can measure and better understand their burnout. Burnout can manifest differently for each individual, even those who are in the same workplace. We want to empower you to better understand your own experiences and push for the changes that will have the most impact on your quality of life in and outside of the workplace. We'll introduce a range of evidence-based burnout assessment tools and discuss the different dimensions they use to assess burnout. We'll then describe how to interpret your scores, so you'll do a practice on one of these assessment tools, and we'll explore related tools that can be paired with the burnout assessment that you did. If you missed any of our previous webinars, you can find the webinar slides, recordings, and transcripts on the webinar registration page, which we'll post in the chat right now. The slides for today's presentation are also there and are being posted in the chat now. And I do want to put in a little plug for a publication we released this month that complements this webinar. It's an executive summary, and we also have an infographic on using burnout assessment tools. These resources and all future publications can be found on our publications page, and we'll post links to these documents in the chat as well. For today's presentation, we're really excited to have Molly Meinbrust share her experiences and expertise with you all. Molly, you may recognize Molly from previous sessions. She is one of the wizards behind the curtain to bring this initiative to life. She is the Associate Director of the NHSC Educational Programs at the Association of Clinicians for the Underserved. She's provided training and technical assistance to clinicians in the community health center field for over 10 years. Prior to joining ACU, she supported health centers through research and clinical education activities at the National Healthcare for the Homeless Council. In addition to her work with health centers at the national level, she spent several years providing and supervising direct services to individuals experiencing homelessness and other low-income and underinsured populations. She has extensive knowledge of the social determinants of health that historically marginalized populations face, and expertise in building community partnerships to improve access to needed services. We hope you learn a lot from Molly today. There will be plenty of opportunities to engage with her and fellow attendees throughout this presentation through polling, through the chat box, and by raising your hand to speak. So please make sure those opportunities to interact. Please make sure to use those opportunities to interact with each other today. Just a few housekeeping things before I hand the mic over to Molly to get us started. I just want to share that this webinar is being recorded, and a link to the recording will be emailed to you within 2 days. The PowerPoint slides can be found on the webinar registration page, which is linked in the chat. This is a 2-hour webinar, so we'll have plenty of time for Q&A at the end of the presentation. And Molly will ask you some questions throughout the presentations that will hopefully spur some conversation. Please type the questions that you have for the presenter in the chat box on the right of your screen. And again, if you missed the instructions, just go ahead and click that little chat icon on the bottom right-hand side of your screen to open the chat box. If you have any technical assistance questions, please contact our colleague Josh. His contact information is pasted in the chat. Polling will be used throughout the presentation using the Slido platform, and you have 3 options for responding. The first is to respond in the Slido box, which will pop up on the right side of your screen each time a new poll begins. And the second option is to take a picture of the QR code on the polling slide with your cell phone and enter the password provided, which will take you to the Slido website for this webinar. You can also manually navigate to the Slido website by using the link provided on the slide and entering a numeric code and then entering the passcode. Once you've opened Slido using the QR code or the URL, it will automatically update with the next polling question as long as you keep that Slido window open. Finally, we'd also appreciate your feedback on today's session, so please complete our survey at the end of the webinar to let us know how we did and how we can improve our trainings. To see closed captions, click on the CC icon on the bottom left corner of the window. And then at this point, I see that you're all completing the Slido poll about what role you serve in terms of the NHSC programs. And so while you're doing that, I want to hand it on over to Molly. Thank you, Molly.
Thank you, Sabrina, for the lovely introduction, and thank you to Diane as well. We're so glad to have someone from HRSA on the call with us. And thanks to everyone who's submitted their answers to our first Slido poll for today. So looks like we have a good mix of folks on the call. We have some site points of contact, Scholar who's in the field, Scholar, an S2S LRP participant in the field, and C-suite leadership. So a good mix of NHSC participants and leadership at NHSC approved sites. It looks like a few more people have responded. Great, we've got some more points of contact. That's excellent. We really love the mix of folks who are here because we want NHSC participants to know how to measure burnout within themselves, but also to have site leadership here is really important so that you all know what tools are available. And like Sabrina mentioned in the introduction, we'll have another webinar in April looking at how to measure burnout at the organizational level. So today we'll dive deep into the different evidence-based tools that are out there and how to use them. And then in April, like a larger picture conversation around how to implement those tools and what you do with the results of them, looking at your whole workforce. Thank you again for being here. Just wanted to let you know too, I am recovering from a cold, so excuse me if I have to sneeze or sniffle or cough. And then also the technology is going to be really interesting today. I'm going to be sharing where to find all of these burnout assessment tools. So I'll be switching back and forth between the PowerPoint slides and my internet browser to show you how to access them. So just bear with us with all of those back and forth that we'll be doing today. So just want to start out to cover our learning objectives for today. We will first define burnout for you all. Then we'll describe how to use the evidence-based burnout tools that exist. We will share some of those commonly used and validated burnout assessment tools. And then we'll actually practice using one and calculating your score, and we'll talk about that experience and how it's going for you when you see what your burnout score is and what you want to do with that information. And then finally, we'll talk about approaches to advocating to leadership about workplace modifications to help prevent and mitigate burnout. So we have another Slido poll for you all to start out. Have you ever experienced burnout? And it could be in any job, your current job, jobs you had, years in the past. Just want to get a feel for the experience of burnout that you all have had on this call today. And just so you know, when you're submitting responses, you can submit anonymously if any of this feels like sensitive information that you don't want your name attached to it. And also, if you're having trouble with Slido, you can post any information in the chat, and Sabrina's going to help me keep an eye on that chat. So it looks like the majority of the folks who are responding have experienced burnout on the job. We've got 86% saying yes, 14% saying not sure. And maybe as we define burnout and talk about it more, you might have a better idea if you have experienced it. So for those of you who responded that you did experience burnout at some point at any job that you've had, how did you know that you were experiencing burnout? What symptoms did you have, or what came up for you that let you know, like, I think I'm experiencing burnout? And we'll give folks a minute to submit some answers. I see a few people typing answers in now. And thank you all so much in advance for sharing today. Again, this could be really vulnerable, and happy to have your participation. So Jen is saying frustration. Sarah's saying high anxiety and irritability. Yeah, so when you're experiencing a lot of stress, you might start to be short with people that you're interacting with at the job, patients, coworkers, maybe your family. Again, we're seeing impatient with people from Lori, frustration over the different stressors that you're experiencing. Thanks, everybody. That's really helpful to see. Oh, I see one more participant is typing, so I'll wait for them. Okay, not motivated with my work, things becoming overwhelming. And these are really great examples of symptoms and feelings that can come up. And they're also related to like some of the definitions of burnout that we're about to get into. But maybe you don't feel like going into work in the morning, or you don't want to work on your notes, or you don't feel like seeing all your patients, and you just are feeling extremely overwhelmed with everything that you have to do. So we'll do a little bit of background on burnout before we get into the assessment tools. So looking at the definition of burnout, we're using the World Health Organization definition, and this is a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. So this is a chronic issue, right, from workplace stressors. So we really want to emphasize that burnout, and like Sabrina said at the beginning, it's a workplace phenomenon. It's not because of individual weaknesses, right? These are issues, stressors that are coming from the work environment that have not been successfully managed or dealt with or resolved. And so there's different pieces of this burnout that the World Health Organization includes. So the first piece is exhaustion. So I think someone mentioned that in the previous slide, just feeling totally exhausted and overwhelmed with work. And it could be physical exhaustion, emotional exhaustion, all of those things. And then we've got the mental distancing from or negative feelings towards work. And I think someone else mentioned that in the Slido poll, just like not feeling motivated to do your work or interact with your patients, just feeling really detached from work. And maybe coming in with a bad attitude sometimes. And then finally, that third factor is the reduced personal effectiveness on the job. So if you're tired and you're feeling really detached, like how well do you think you'll be doing your job? You may not be as effective as you normally would be if you were feeling good and positive and happy about being in the workplace. So these are the three factors that are included in this definition of burnout. I will add a caveat that there are other definitions of burnout, and when we get into the different assessment tools, you'll see that each of them kind of define and measure burnout differently. But this is a definition that we're starting with. And just another note is that burnout, there's a spectrum. It's not like you have burnout or you don't. There's, again, different pieces like the exhaustion, the mental distancing, the reduced personal effectiveness. And some people might be on the lower end, they're just feeling a little bit of burnout, or they might be on the other end where it's really impacting their work, their personal life, etc. All right, got another Slido poll for you all. So for those of you who have experienced burnout, and maybe some of you are like, oh, maybe I have experienced burnout. What do you think were some of the drivers of that burnout? What was causing that burnout for you at the time? See some people typing. Thank you. I'll give you a minute. So we've got poor management. And if you want to explain a little bit more, Anonymous, I'm going to guess that's management at whatever organization or company you were at. So issues around leadership and structure, managing of programs. Let's see, too much work creeping into my off hours. So sometimes people call that pajama time, work that you're doing at home when you should be with your family or partners or friends. Unwillingness to implement feedback from providers. So leadership not listening to you when you have feedback. Additional work assigned without additional support. So having a burdensome level of work to do without support. Overload of family crisis while balancing 1.5 jobs. That's a lot, yeah. And so that's a good point. Sometimes personal matters will impact your work and can make you feel burnt out. And we'll get into a burnout assessment tool that actually looks at burnout in multiple areas of your life, because you could have burnout in your job, you could also have burnout in your personal life. Working after hours increase, yep. Working overtime, short staff, yes. And I think we probably all saw a lot of that in COVID when people were getting sick and couldn't be at work, and we were just like in an emergency situation, and there was so much to do. Unrealistic goals that make providers choose between their own self-care or the well-being of their patients. Thank you for that. Yeah, there are a lot of expectations put on clinicians to see so many patients per day, And then, yeah, putting it on the individual clinician to take care of themselves when there's so much that the organization can be doing to really provide that support. Thank you all again for your answers. So let's get into what the literature says about why clinicians might be experiencing burnout. And of course, you all mentioned a lot of the things that are in the literature, but it looks different for everybody. So you could have a combination of these issues or just one of them that's like really impacting you intensely. So we've got lack of control. That's clinicians not having control over their schedules, how many patients they're seeing, how many people are on their panel, what time they come in or when they can leave, if they're part-time, full-time, not having control over decisions that are being made about things that they have to do. Is leadership listening to them? Someone mentioned that, leadership not listening to feedback. And also high workload, and many of you mentioned this too. So not enough time to get everything done, or competing interests, taking care of yourself versus taking care of your patients. And then seeing patients who have really complex needs. Of course, you all are working in health professional shortage areas, in health centers and clinics where patients are experiencing a lot of barriers to care and lots of social determinants of health that are negatively impacting their health. And that's really complicated stuff to deal with in a maybe 15-minute clinical visit. So just being overwhelmed by that can be really difficult, and especially if you don't have the resources that you need to take care of all of them, or like the support, like a team to help you with them. Then also the EHR documentation. Some of you talked about the work in your bleeding into like your personal life. So, I know my sister, she's a nurse practitioner, and she was working on notes at home constantly. And she really had to work on figuring out how to resolve that, because it was impacting her time with her kids and her husband and the other things that she wanted to do. And then, of course, lack of supportive leadership. Some of you all mentioned that. So is your leadership listening to you? Are they looking out for you, making sure that you're safe in your work and that you're supported, that practices are set up to make the workflow efficient? Are they even paying attention to what's going on? Do they really have like their finger on the pulse of what's happening in your clinic? Work-life balance issues. So again, taking work home, but maybe also some personal issues are a lot and impacting your work. So it's causing burnout in lots of different areas. And then that moral distress issue. So if you haven't heard that term, that's when there, like I mentioned before, like you have these really complex issues with patients who are coming in, really complex, challenging care, and you don't have the resources to fully address the issues that they're dealing with. And a lot of times it's outside of your control. So you're feeling kind of defeated, and maybe like your organization isn't able to provide the resources, or the community doesn't, or like certain benefits aren't available to those patients. And so it can lead to this moral distress. And then also moral injury, which is like the long-term moral distress on the clinician, and can lead to emotional and physical outcomes. I know I experienced that. In my introduction, Sabrina mentioned that I used to work in homeless outreach, and there was a lot of moral distress and moral injury in that job, because so many things are stacked against individuals experiencing homelessness. And it could be really defeating at times. And it's great when your organization is able to help provide resources, or you can make connections in your community to find like social services and other entities that can help support the folks that you're working with. There's just a little diagram of moral distress and moral injury. and the connection between moral injury and burnout, that it can leave clinicians potentially depressed and having issues with relationships and low morale at the job. And some more examples of how burnout can impact clinicians. So there's physical and mental health issues, and we won't get too deep into this. If you all missed the webinar we had a month or two ago, it was a longer presentation on clinician burnout, and it looked at the scope and the implications of burnout in clinicians and all those signs and symptoms and impacts. But of course, you know, you could have a neck ache or backache or depression related to this burnout, extreme fatigue. Folks have mentioned that. Memory and concentration issues, like that extreme stress can really impact your ability to recall information and focus while you're at work or even at home. Burnout can also lead to medical errors, the literature shows, and that's a big concern around patient care and safety. So we really want to keep an eye out for that. And then it can also be related to low patient satisfaction. If you're feeling detached and tired, like it really may come across to patients when you're interacting with them. And then also we see that desire to leave healthcare completely from certain people who are experiencing high levels of burnout. And of course, we don't want that. That's why we're talking to you all. That's why this initiative is in place, is we really want to make sure that the NHSC participants are really supported in our NHSC approved sites. We want you all to stay in the communities where you're working. You're really needed there. And we want to make sure that the best practices and interventions are in place so that you all do want to continue this really, really important work. So taking action against burnout. How do we address it? One step is to see where you are. If you're not sure if you're experiencing burnout, or you think you are, but you're not sure what the causes are or how to address it, the first step can really be using one of these burnout self-assessment tools to help evaluate your level of burnout. And it's not a diagnostic tool. Like, burnout is not something we can test with a blood test or anything. It's a syndrome of experiences, right? It's that exhaustion, the detachment, the reduced personal effectiveness. So burnout assessment tools were created to help assess this experience of burnout. So kind of like the PHQ-9 that assesses for depression, there are also shorter versions, you know, like the PHQ-2. So some of the assessment tools that we'll go over, they have the longer versions, the shorter versions, because as you all know, sometimes when you're filling out forms, it can be really exhausting to fill out a very lengthy form. And if you want to reduce the burden on someone maybe who's already experiencing burnout, a shorter version can really help. Then thinking about, you know, which tools to pick out, some things you want to think about: has it been validated? If you don't know a lot about how measurement tools are developed, they look through a lot of different factors when they're creating a measurement tool. So is it actually measuring what it's supposed to measure, or is it measuring something else? And do the scores represent what they're supposed to? So you can use a measurement tool and then compare with a diagnosis by a trained professional and see if it's actually measuring what it's supposed to. So that's the validity. There's also the reliability piece. Is it measuring accurately over and over and over with different people? So is it accurately measuring burnout with 20 different people, not just one person? So when a tool is evidence-based, they're looking at all of these issues. And then also, when you're thinking about choosing a burnout assessment tool, you want to think about what dimensions of burnout does it measure. And I think, like I mentioned before, there's that definition that the World Health Organization uses of burnout. The different evidence-based assessment tools are measuring different dimensions or subscales of burnout. And so we'll get into that. And that may impact which one you want to use. And then also, is there a fee to use it? At least one of them has a fee. Most of them are free, which is great. So that may impact your decision making. Then also, some of them measure changes or level of burnout over a certain time period. So you may want to consider that factor as well. I will mention that the Maslow Burnout Inventory, it was one of the oldest and widely used burnout assessment tools. It's the first one we'll get into. And then developers of subsequent tools have constructive criticisms around the Maslow Burnout Inventory, and they've chosen to use alternative definitions of burnout, and we'll get into that. And just a little note, and when you get these slides, we have a resource that we developed and put out, I think about a month ago, looking at the signs of clinician burnout. So that can be really helpful to reference. Also, we have another one on the causes of burnout. So it provides a little bit more detail than what we had on that slide previously. All right, so let's get into these burnout assessment tools. So the first one is the one I just mentioned, the Maslow Burnout Inventory. I should mention too that some of the different assessment tools are made for different occupations. And I believe the Maslow Burnout Inventory was originally developed for clinicians, but at this point, it's been around. It's the oldest one we've had, right? It was developed in 1981. So at this point, they've done a lot of research and a lot of expansion, and they have different options for different occupations. But they do have a specific one for human services, medical personnel, for healthcare workers. So that's the one that you'd want to use. Unless you're leadership staff, then you may want to choose a separate one. But we're focusing on the clinicians today. That one assesses how often feelings are occurring around the emotional exhaustion, depersonalization, and personal accomplishment. So what they're measuring is directly tied to that World Health Organization definition. And there's 22 items, so not too long. There's some shorter ones though. So what I'm going to do now is show you how to access that Maslow Burnout Inventory. This is one that actually does cost money. It's $15 for individuals. And then I think there are discounts if you're like measuring burnout across an organization. So here's a website where you would go to find the Maslow Burnout Inventory tool. It's on this Mind Garden website. The authors are Christina Maslow, Susan E. Jackson. So you would scroll down, it's showing you the scales that they measure that I just mentioned. And then if you wanted to use it, you can get this lengthy description of the Maslow Burnout Inventory. But if you really just want to do an individual report for medical personnel, you can pick that one. And it will give you a report interpreting your results. And then it looks like you can get a longer report for additional, and then here are those group reports. So I'm going to, and can, Sabrina, can you let me know if everyone can see that okay?
Yep, we can see it. Thank you.
Okay, perfect. The technology is working. Okay, I'm going to go back to the slide so I can show you a few examples of the questions that they use. So we've got emotional exhaustion. One of the sample items is, I feel emotionally drained from my work. And then one of the items under the personal accomplishment subscale is, I have accomplished many worthwhile things in this job. And then what's going to happen is there's not an overall score for this burnout assessment tool. And so this is a difference that you'll see between the different assessment tools. Some give you an overall burnout score, and some are just going to give you a score for each subscale. And so that's the case with the Maslow Burnout Inventory. The response options to these items are never to daily, 0 to 6, and then you would have they would say you have a high level of burnout if your score is greater than or equal to 27 in emotional exhaustion, greater than or equal to 10 in depersonalization, and less than or equal to 33 in personal accomplishment. And because the Maslow Burnout inventory costs money. They don't show you all of the questions or items for free on their site, but later on in the presentation, I'm going to show you one place where you can find, I think it's an older version of it, but if you really want to see those questions. But just a little bit more about the different, the different subscales. So how they're defining emotional exhaustion is overextended stress, physical and mental exhaustion. And then for depersonalization, it's that emotional distancing, that detachment, negative feelings towards one job. It could be a response to the exhaustion and an active self-protection, but it can also lead to depersonalization with your patients and your colleagues. And then that last subscale, personal accomplishment, could be a lack of productivity or personal accomplishment on the job, and it can come from that exhaustion and the detachment. It can also come from the lack of resources necessary to complete your job effectively. And then once you get your score with the NBI, they provide sort of 5 work experience profiles based on your scores. So what they've got here is burnout, overextended, ineffective, disengaged, and engagement. So it's kind of going from most severe to least severe. So if you've got burnout, you've got negative scores on all of those subscales. Overextended would be strong negative score on the exhaustion only piece. Ineffective would be strong negative scores on professional efficacy only. Disengaged would be strong negative score on cynicism only. And then engagement, which is sort of like the ideal outcome, is that you have strong positive scores on exhaustion, cynicism, and professional efficacy. And so this is a tool that can be helpful to see, like really to pinpoint where your burnout is occurring, because once you know how you're, like, where the burnout is coming from and how it's impacting you, it helps you decide what interventions or what coping strategies you would want to use to address that burnout. And again, it's going to look different for everyone. All right, so the next one is the Oldenburg Burnout Inventory, also called the OLBI. A lot of them have acronyms or shortened abbreviations. So for this assessment tool is for any occupation, and it has 16 items, so a little bit shorter than the MBI. Unlike the Maslow Burnout Inventory, it does not measure professional accomplishment. So it's measuring exhaustion, the cognitive and physical exhaustion, and then engagement. And the reason for this is because the developers of this tool felt that that professional accomplishment piece was really a result of the burnout rather than a core component of that burnout. So that disengagement piece, again, we talked about the devaluing of your work, having negative feelings towards it, and the desire to discontinue that work. So let me show you how to find that tool. This one's a little wonky. And that's why I'm showing you all, because they can be a little tricky to find. So, and we've got links to all of them on the slides. And actually, there's a really great infographic that we put out that I'll show you. But you'll go to this SlideShare website, and if you scroll down to the last page of the document, and you might get some pop-up ads in the process. If you scroll to the very last page, you can see the actual questions that are in the Oldenburg Burnout Inventory. So most of these are going to have different items or questions, and then whether you strongly agree or disagree, Likert scale. So here's the 16 questions. And as with some of the other assessments, some are positively worded questions or items, and some are negatively worded, which can impact the scoring. And so you just have to be careful of that if you're going to use a questionnaire that has negatively and positively worded items, because you'll have to reverse scoring. So if you're trying to calculate, strongly agree would be 1 on one answer, and then for another one, if it's a reverse scoring and you have a 4, you would have to change it to a 1. So even just talking about it is a little confusing, which is why some other tools don't have any negatively worded, or they just stick with 1, positively or negatively worded, because it just makes scoring easier. And I should make a note too, a lot of these measurement tools were developed for research purposes, and obviously they can be used individually, but I think they weren't always thinking about the end user in mind. They were, thinking about their research assistants who can easily score these items. Again, just something to keep in mind. Okay, I'm going to go back to the slides so I can show you some examples of the questions. So this one has subscales of 2, right? We've got the disengagement subscale and the exhaustion subscale. So an example question of the disengagement question or item would be, it happens more and more often that I talk about my work in a negative negative way. And then an example item from the exhaustion subscale, after working, I have enough energy for my leisure activities. I'm just going to take a break and have a sip of water. Hold on. And as you all saw, when I showed you the items, you're going to respond if you strongly agree or disagree to those statements. And then there's how you would score on the slide if you have a high level of burnout. If you would have greater than or equal to to 2.25 in exhaustion and greater than or equal to 2.21 in disengagement. So again, you're not getting an overall score of burnout. You're getting scores on your individual subscales. All right, I'm going to move us on to the Copenhagen Burnout Inventory. So this audience is for any human services occupations. And it defines burnout as prolonged physical and psychological exhaustion, and it measures it in 3 life spheres. So it's not doing like the personal accomplishment, the exhaustion, the disengagement as different subscales. It's measuring, do you have burnout in your personal life? Is it work related, or is it specifically client related? So this is allowing individuals to assess their burnout even if they don't work, or if they do work but they don't have clients. It also allows individuals who work with clients to sort of parse out your perceived source of where the burnout symptoms are coming from, if it's not just from work. And again, this is helpful in identifying solutions and coping mechanisms. So this could be helpful for someone like, who mentioned early in one of the Slido polls is having like a family crisis plus 1.5 jobs. You might be having burnout from your job, but you might also be having it in your personal life. And for this tool, clients can be patients, students, inmates, any individual receiving services. Doesn't have to just be a patient. Like I mentioned, this does not measure depersonalization as because the developers saw that as a coping mechanism to manage burnout. And it also doesn't measure personal accomplishment because that was seen as a consequence of burnout. So I'm going to show you how to access this. All right. So the Copenhagen Burnout Inventory, you're going to click on this first link here. And that actually will take you here. So you'll get a PDF of the Copenhagen Burnout Inventory, or CBI. And you can see it's separated by those different sections. So you've got the questions around personal burnout. How often do you feel tired? How often are you physically exhausted? So you can see none of it's related to a job or patients. And then it shows you how to score. You've got response options from always to never, almost never, with numbers associated with those answers. And then you've got the second section on the work-related burnout. Is your work emotionally exhausting? Do you feel burnout because of your work? Again, it shows you how to score. And then part 3 is around that client-related burnout. Do you find it hard to work with clients? Do you find it frustrating? Does it drain your energy to work with clients? So you're getting a good feel for the burnout that's particularly related to working with clients or patients. I hope this going back and forth is working for everybody. So that one has 19 questions. It's a little bit on the longer side, and measures those 3 subscales. So basically, these developers are stating that if you have a score of greater than or equal to 50 in each of those categories, it means that you have burnout present in those categories. And I already shared some of the examples, but here's some additional ones around personal burnout. I can't take it anymore. And then, does your work frustrate you? I think that's an error. That should be work related, not client related. All right, I'm going to move on to the Mini-Z survey. So this survey was developed based on the Z questionnaire. It was used in a zero burnout program, which was part of or a result of the physician work-life survey. So it was originally developed for physicians, looking at job satisfaction and burnout. So it has, at this point been expanded to individuals beyond physicians. And they were looking at quality of patient care, physician reactions, and things like that. So it's much shorter. It has 10 questions, and it's for any occupation at this point. And it's looking at the supportive work environment and work pace and EMR stress. So you will get an overall score for this one, and it will tell you if you have a joyful workplace. It does have the 2 subscales, of course, on supportive work environment and work pace and EMR stress. And they have lots of different options to use. The one we recommend is the Mini-Z 2.0 for clinicians, but they also have one for medical residents and fellows, which might be helpful for those of you who are still in school. So I will go ahead and show you all how to access that one. Again, if you want to follow along, you can pull up the slides for today and take a look yourselves. So we've got the Mini-Z. You'll go to the professionalworklife.com website, and here is the link to the Mini-Z. And if you click on that, it's actually going to download a Word document. So I'm going to show you that Word document in a second. There's some other items on here we'll look at later, and like the generic deep dive survey for clinicians, and a way to summarize your reports if you're looking at responses from lots of different individuals. But I will show you that scale now. Okay. So we've got the Mini-Z, and this we've got overall, I am satisfied with my current job. These are just examples of questions. And the second one, using your own definition of burnout, please choose one of the numbers below. I enjoy doing my work. I have no symptoms of burnout. I am under stress. I don't always have as much energy as I did, but I don't feel burned out. I'm beginning to burn out and have one or more symptoms of burnout and emotional exhaustion. Also, if you need to see this better, there is an option to zoom in the WebEx window. It's right above the slides. If you click the plus sign, you can zoom in. Option 2 is symptoms of burnout that I'm experiencing won't go away. I think about work frustrations a lot. And then 1, I feel completely burned out. I'm at the point where I may need to seek help. The reason I read all of those out is because that question number 2 is considered a 1-item measure of burnout. So you can do the whole mini Z, which is 10 questions or 10 items total, or you can just do that 1 item, and that's been shown to predict or to adequately assess for burnout. Just that 1 question, number 2. So let me go back to, sorry, so there's that first subscale, and then there's the other one about the EMR workplace stress. So I have a great deal of stress because of my job. Sufficient time for documentation is, range from poor to optimal, etc. All right, and so I just read out to you all of those options for that 1-item burnout measure. But that can be great if you're just trying to get like a quick measure of your burnout, or like if you're in a team meeting with everybody on a Monday morning and you just want to like, hey, everybody, how are you feeling on this scale, 1 to 5? And that'll kind of give like a very quick picture of what's going on. So what the developers have said is if the response is between 1 and 3, then burnout is present. And this might help some of you who at the beginning who said you weren't sure if you've ever experienced burnout. This might let you know. All right, I will move on to the Stanford Professional Fulfillment Index. And we just have a couple left, so bear with me. 3 left, and then we'll get into practicing. But we really just wanted to give you all an idea of what's out there so that you pick the one that works best for you, or your organization is picking the one that works best for your team. And sometimes you might use a combination of tools. Maybe you want to see, is your burnout work, client, or personal related? And then if it is work related, then you want to use a different tool and get more deep into where that's coming from. The mini Z is great because it kind of does really pull out areas where the burnout might be coming from. So the Stanford Professional Fulfillment Index, or the PFI, it actually was originally developed for physicians, and it's pretty much stuck that way. So it won't necessarily be useful for nurse practitioners or dentists or PAs. You could use it, but it really, it's only been researched among physicians. So it assesses the degree of intrinsic positive reward. Oh, sorry, sorry, let me step back. So there's 2 different subscales. We've got professional fulfillment and then burnout. And then within the burnout subscale, you've got more subscales: work exhaustion and interpersonal disengagement. So the professional fulfillment piece assesses the degree of intrinsic positive reward that we derive from our work. And so that includes happiness, meaningfulness, contribution, self-worth, satisfaction, and feeling in control when dealing with difficult problems of work. So it's kind of like 2 ends of the spectrum. We've got the professional fulfillment piece and then the burnout piece. And that's looking at the work exhaustion and the interpersonal disengagement, which I think we've defined many times already. So again, it was designed for physicians and also biomedical research scientists. And it looks at experience of burnout over the last 2 weeks, which means it's helpful for looking at measuring changes in burnout over time. So if you wanted to look at burnout before and after an intervention, or before and after or during like a major event like a COVID-19 pandemic, it can be really useful there. So let me show you how to access the Professional Fulfillment Index. This one is free. This one is free, and it will give you a short report of what your responses are. So the link we have goes straight to the burnout subscale. If you want to use the professional fulfillment one, you can do that one. It's right above it. But this is handy because you can just enter your results right here in the website. And so an example of an item is during the past 2 weeks, I have felt a sense of dread when I think about the work I have to do. And you're going to answer from not at all to extremely lacking enthusiasm at work. Or during the past 2 weeks, my job has contributed to me feeling less empathetic with my patients, less empathetic with my colleagues, etc. So once you enter all that, you'll click this arrow and it's going to give you a report. They have other items or measures on this website if you're interested. They have a self-valuation, self-compassion one, and that's looking at resilience. They also have sleep-related impairment. So those would be that would be a consequence of burnout. And they also have impact of work on personal relationships. Again, it's designed for physicians, but you could use it if you're not a physician, just knowing that it wasn't necessarily designed for all occupations. I'll go back to the slides real quick. So there's an example of interpersonal disengagement item. During the past 2 weeks, my job has contributed to me feeling less empathetic with my patients. Again, the response options were not at all too extremely. And basically, I can't tell you what the scores are because they don't provide that information, but the online report after you submit your answers will result in a favorable or unfavorable burnout level, and it will give you a little bit more of an explanation around what that means. All right, so then we have the professional quality of life measure. People often refer to it as the ProQual, so I probably will use that as well. It's easier to say. So it's for any individuals or anyone working with individuals who have experienced extremely stressful events. It was originally designed to measure work satisfaction and negative effects of work-related trauma with individuals who were victims of torture. So it was a really specific population of providers they were looking at originally, but like other measures and over time and with research and studying it among different folks, it's now expanded to anyone in the helping profession. But especially, for people who are serving those who've gone through extremely stressful events, like someone who's experiencing homelessness or who's been through a natural disaster or who has experienced sexual assault. This one has 30 items, so it's a lot longer than the other ones. But it's looking at compassion fatigue and compassion satisfaction. And burnout is a subscale under the compassion fatigue dimension and also secondary traumatic stress. So this one looks pretty different than the other ones. And that compassion satisfaction is defined as the pleasure you derive from being able to do your work well. And under compassion fatigue, burnout is defined as feelings of hopelessness and difficulties in dealing with your work or in doing your job effectively. And that secondary traumatic stress, which is probably a term you've all heard, is associated with your work-related secondary exposure to extremely or traumatically stressful events. And this tool is looking at the experience within the last 30 days. So another tool that gives you sort of like a time range of when you were experiencing these. It also has reverse scoring that we've talked about, so it can make it a little bit more complicated to use. You'll just have to do a little bit more work when you are doing the scoring. So you're going to go to the ProQual website and you'll scroll down You can go past, you can enter your information here and it's part of their research if you want to be part of their research, or you can keep going down and click on download the English version. And then there's a scoring option as well. So I think I've already got the blank version open. So you can see here example items. I am happy. I am preoccupied with more than one person. I help. I get satisfaction from being able to help people. I feel connected to others. I jump or am startled by unexpected sounds. So you can see how that's getting into that secondary traumatic stress. I find it difficult to separate my personal life from my life as a helper. So work bleeding into your personal life. And your response option here is never to very often. I just want to show you too the scoring document. So it also has a blank version, but then it gets into how to score the different subscales of the compassion satisfaction, the burnout, and the secondary traumatic stress. And it gives you a lot of great information about what those different scores mean if you choose to use this one. And so it explains very in depth how to do the scoring. So it is a more complicated one because of the reversing, but it also gives you a lot of great information on how to do the scoring. Again, all of these links are in the PowerPoint, and I think Sabrina has been putting the links in the chat. So thank you for that, Sabrina. I might take a quick break here for another sip of water. If folks want to also take a sip of water, maybe stretch, stand up, look away from the computer, relax your eyes. All right, I think we have one left, and then we'll get into practicing a tool. For that pro-qual, really quick, for the burnout level, if your score is less than or equal to 22, you have low burnout. If the score is 23 to 41, moderate burnout, and then greater than or equal to 42, high burnout. All right, so the last tool we're talking about is the burnout assessment tool, also known as the BAT. It's a much newer one, and it really is responding to the Maslow burnout inventory by, adding some pieces, subtracting some pieces that it's measuring. They are not looking at personal accomplishment because the developers also decided it was a product of burnout. So they've got the mental exhaustion piece, they've got the mental distancing piece, and then they've got the emotional impairment and cognitive impairment. So cognitive impairment came out of some research they did in creating this fourth dimension. It's looking at the cognitive functioning and memory. So that was one thing we talked about, that exhaustion that can cause the inability to focus and recall information. And sometimes these cognitive issues can last beyond the resolution of the burnout. So it's a really important piece to consider. But other criticisms the developers of the BAT had around the Maslow burnout inventory is that the duration of time asked in different questions differs between the questions, so it's not consistent. Some of the language in the Maslow burnout inventory is really extreme, and that can skew how people respond. So the developers of the BAT wanted to reduce as much bias as possible, or leading the witness, so to speak. And also in the Maslow burnout inventory, some dimensions are positively worded and some are negatively worded. And so, and are less like correlated with one another. And it also doesn't result in an overall burnout score, which a lot of people are looking for. So the BAT does that. It's addressing all the issues they felt are that exist with the Maslow burnout inventory. And then it's also giving you an overall score, which is really nice. And that's the one we're going to practice with because it's probably the simplest to use. So let me show you how to find that. A quick note too. So there's the core symptoms, of course, the exhaustion, the emotional impairment, cognitive impairment, the mental distancing, and there's an extended version you can use to look at secondary symptoms, which would be psychological distress, psychosomatic complaints, and depressed mood. But that's optional, of course. So let me show you how to pull up the BAT. Okay, so you're going to get to the Burnout Assessment Tool website, and you can click on the scientific version, which will give you a little bit more background information about how the tool was developed. I recommend clicking on the English practical version. And sorry, I think I've already got that pulled up. Oh yeah, so you'll get the user manual burnout assessment tool. So this one gives you a lot of extra information as well. And you'll scroll down to the actual tool. So if you go, it's the work-related version, which is the one I recommend to you all. That's on page 20. So we'll scroll down there. Here we go. So again, we've got this Likert scale of never to always, and we've got the core symptoms, right? At work, I feel mentally exhausted. Everything I do at work requires a great deal of effort. After a day at work, I find it hard to recover my energy. So they're really getting at that exhaustion piece. At work, I have trouble staying focused. At work, I struggle to think clearly. So then they're getting into the cognitive pieces. So it ends at 23, but you can do the secondary symptoms here. And examples are, I have trouble falling or staying asleep. I tend to worry. So it's like, how is this burnout impacting you outside of work, or physically and mentally and cognitively? All right. And I gave you some sample items already, but another mental distancing item is I'm cynical about what my work means to others. An emotional impairment example item is during my work, I become irritable when things don't go my way. And a couple of you definitely mentioned irritability as how you sort of knew you were experiencing burnout. The cool thing about this questionnaire is that the scoring is set up like a stoplight system or a traffic light system. So if you have a score of less than or equal to 2.58, no burnout is present. If your score is between 2.59 and 3.01, there's a risk of burnout. And if the score is greater than or equal to 3.02, burnout is likely. And I will say, I think if you actually read through the documents they create, they say orange, but I think it's because they're in a different country, and maybe in that country, the stoplights, they call it orange instead of yellow. So just FYI, in case you're getting into the details about that particular assessment. Before we try it, I just wanted to mention a few things. So there is a document from John Snow Inc., and it was a document that they actually developed for HRSA, and it's a literature review summary of burnout and health center workforce survey. So that's where they give a lot of the sample questions of these burnout assessment tools. Some of the ones that we presented today. And I know I told you that the Maslow Burnout Inventory, they don't give you the questions on the website, but if you really want to see what those questions are, there's actually a copy of them in this document. And there's a link. Actually, I could probably put it. Let me see if I can put it in the chat for you all. Yep, I'm going to put it here. Okay, so if you go to that literature summary, you can scroll deep into the document and it'll show you the sample questions from the Maslow Burnout Inventory. Okay. I want to again mention the infographic that Sabrina talked about in the introduction because I think it's one of a kind, and I'm gonna go ahead and show you all how to find it and what it looks like. I think it's really cool, not just because I made it, but because I think it really, like, no one else has made a document like this. So it shows all of the evidence-based burnout assessment tools with quick links of where to find them, the dimensions that they measure, and also how to score them, all in one page. Um, so if you've not been to our publications page, I'm going to show you it right now. So all the publications that we've published this year so far are on this page. And of course, you can find future ones here as well. So we've got the burnout assessment resources right up top. We've got some of the social determinants of health resources that we've published related to the other webinars we've had, additional clinician burnout ones, and a community assessment guide that we put out around health disparities and using data. So if you click here on using burnout assessment tools infographic, you'll see what I was talking about. So it's a really great quick reference for the different tools that that are evidence-based. So they've been through all the research and the testing, they're reliable, they're valid. It shows you the audience, who they're for, the different dimensions or subscales that they measure, and then how to score them. And then on the second page, we've just got a quick little guide on how to interpret your scores, investigating the causes of your burnout, and then identifying strategies to address the different causes and dimensions of your burnout. So please definitely make use of that. I think I think we already put a link to it in the chat, but actually I could probably do it again right now. There you go. So if anyone wants to pull it up, it's in the chat and you can take a look at it. Oh, all right.
Molly, we do have a couple of questions.
Sure. Okay.
I don't know if you want to address these now or wait until after you do the practice assessment, but I can.
Well, let's hear them. Yeah.
All right. So the first one is, as a new provider, how do we know when a workplace may be toxic versus areas where we could be doing more to improve burnout? It's a really good question. It's a complex one, but a really good one.
Yeah, I was gonna say the same thing. I think some things to look out for is or are does your leadership focus on clinician wellness? Like, is it part of conversations that they have maybe during check-ins or at team meetings, clinic rounds? Is it part of strategic planning? Like, is there a really intentional effort to look at clinician wellness? Are they measuring burnout? If those things aren't happening, it might be a good indicator that it's not necessarily a priority, or if it might be a priority to some people, but it's not compared to all the other competing priorities, or maybe certain individuals just haven't been able to get certain practices and structures in place to support clinician wellness. And the second part of the question is, what was the second part, Sabrina?
How do we know if it's a toxic place versus just areas where we could do more to improve burnout? So
yeah, so that also gets into sort of like personal coping strategies versus the organizational coping strategies. So of course, you know, we talked about self-care at the beginning. You can do as much self-care as you can and want to and have time to, but at the end of the day, if the organization isn't making changes to make the work environment healthier and more positive, then those coping strategies can only go so far, those personal coping strategies. So I mean, maybe one thing to try is some personal coping strategies, but like if the problems are like still existing with, you know, the number of patients you have to see, the level of EHR documentation, is your leadership open to like bringing in scribes to help with documentation, or are they open to changing your hours, or are they listening to you when you're giving them like constructive feedback, or this isn't working for me, or I want to give more input into how we're making decisions. Those might be indicators that it's not a great working environment for you. Of course, I can't answer the question, you know, how do you know? That's going to be up to you. I think you have to decide what are you willing to put up with, and how, and what are you willing to put up with, you know, like how it's impacting you in your personal life or your work life or your interactions with your colleagues and your patients. So it can be really helpful maybe to talk to colleagues, see how they're feeling, see if they've talked to leadership about these issues, and talk to your medical director, and then keep going up the chain to see where changes can be made. If people are open, if they're not open, it may not be a great situation for you, and you have to decide if you need to leave or not. I hope that answers the question adequately. And if not, type in the chat, you know, some follow-up questions, and Sabrina will let me know.
Yeah, and if anybody else wants to, you know, comment on that, maybe this is something you have experience with, feel free to raise your hand. You can do that in the reaction box on below the webinar screen, or you can, and we can send you a request yourself, or you can just add it to the chat. I would also add, if it's okay, Molly, that, you know, the fact that a work environment is toxic, I mean, toxic can look different for each person, right? And so, but if it seems like the toxic nature is because all of the staff are, you know, kind of exhausted and frustrated and have short tempers, that could be a bigger sign that everybody is feeling that burnout, versus what we see a lot of times is that there's like maybe a specific person in a management or leadership position who is not leading in a way that's very inclusive or that makes people feel empowered in the work that they're doing. Sometimes that comes from one person who's creating a toxic environment.
Yes, and I think someone mentioned that previously, you know, why or where their burnout was coming from, a driver of it, and was like poor management, and that can definitely happen. Thank you, Sabrina. Were there any other questions, or did anyone else want to chime in?
There is one more.
Okay.
How do we know when to exit an organization because there are just no other options for improving burnout?
So it sounds like a similar question. And I know I've heard from National Health Service Corps participants that it can be challenging to leave because I think there are some issues in contracts that you may sign when you join an organization that you can't work for another organization like in the same geographical area. And we have spoken with National Health Service Corps participants who did not feel supported, so much so in their organizations that they left and they moved to another state. They stayed like in the National Health Service Corps, but they did have to actually move to a totally different city and state. And they found an organization that was extremely supportive, and they actually started doing a lot of work with their organization around burnout. We've also had National Health Service Corps participants who saw what was happening with themselves and with their colleagues and advocated to have like a chief wellness officer to do more around burnout. And they were given that position to be that chief wellness officer. So it really just depends on, is the leadership open to it? Are they prioritizing it? And if not, and you're just feeling it so overwhelmed and nothing you've done has made an impact, it's possible that you'll have to leave, but I know that's not possible for everybody. And that's where some of those personal coping strategies may be useful just to help you get through it. But I know that's not the answer people want to hear. And looks like Diane, you might want to chime in. You just turned on your video.
I hope you can hear me. I would also encourage you to talk with, if you are in a site of an NHSC, please talk with your regional representative. They are in every state, and you can access them from our website in terms of looking for the name or the contact. If not, I'm here also, and I think that would be also very valuable to really talk to our regional officers. They were right in the region. They understand a lot of the sites and have gone on site visits. So that's another opportunity for you to express your concerns.
And Diane, NHSC participants can do that through the portal, right? Or is there another way
Yes,
to
they
contact?
can. Yes, they can do that through the portal and also through our website where the regional office opportunities are. It's the webpage of NHSC and it goes to regional operations, and you'll see where in each state you can click on and find out who you should talk to. It's always a whole office, so it's multiple people, but you can do it that way as well.
Thank you so much. Glad you're here to mention all of that for us.
Thank you.
Sabrina, were there any other questions?
That's it for right now. Thank you.
Okay. Thanks, everybody. And let's get into practicing a burnout assessment tool. It'd be really helpful if you have something to write with, or like you can do it on maybe your phone or your computer, but it might be easiest if you have a piece of paper and a pencil or a pen, excuse me, to write down your answers. So we're going to use the burnout assessment tool. And actually, I think I can pull up the link for the chat. All right. So I put the link to the burnout assessment tool document in the chat, and you're going to scroll down to page, I believe it's page 20. So go to the work-related version of the BAT, and we're going to give you some time to complete the survey to the best of your ability and to record your answers for each of the response options. And remember that the never to always response options have scores. It shows in the document. Never is a 1, rarely is a 2, sometimes is a 3, often is a 4, always is a 5. So you also might want a calculator on hand, or maybe use an Excel spreadsheet if you're into that, and you could add up your scores really quickly. So you'll want to add the total score and then divide by the number 23, and that will give you your burnout score. So I'm going to leave the version of the burnout up here on the screen in case people aren't able to pull it up. So I'll stay a few minutes on this first section. It's questions 1 through 14, and then I'll scroll down to the next section, 15 through 23. But I think, we did this presentation last year, and I think folks wanted a little bit more time to do this. So we'll give you maybe about 10 minutes, if that's okay. So go ahead and get started. Raise your hand, and we can have you come off mute if you have questions or you're confused, or post in the chat if you have any questions about accessing the assessment tool or how to score it. I'll post that link in the chat really quick. Someone was asking for the link again. And scroll down to page 20. And I'm sorry for those of you who might have called in and can't see what we're doing, but you could definitely do it afterwards and listen to sort of the discussion around the scores and what they mean. Sorry, I meant to mute myself and accidentally took the slides off, but they're back. Oh, I'm not sure. Oh, okay. I'm sorry. I'm not sharing the actual questions. Here we go. Feel free to chime in too in the chat if you're done, just to give us a good idea of how long it's taken for folks. We don't want to give too long if everyone's finished. I'm going to scroll down to the next section here. All right. Shanice has finished. Thank you, Shanice. And I hope I said your name right. I'm not going to stop quite yet because some folks might still be working on it, but thank you. It's helpful. Also, feel free to drop your score in the chat if you feel comfortable. You know, we want to reduce the stigma around burnout. Happens to a lot of us, and that's okay. I see Lori's finished. Thank you, Lori. Yeah, and it's not like you have a personal weakness if you're experiencing burnout. Again, it's a lot having to do with the work environment that you're in. Thanks, Teresa. So looks like it's taking about 5 minutes for folks, but I know we have some other folks on the call, so I'll wait a little bit longer. All right, Sabrina finished. Thank you. I think I'll wait a couple more minutes before we start talking about the scores. All right, Michelle also finished. Again, hope I pronounced your name okay. Maybe throw in the chat, have any of you ever used the burnout assessment tool? Or is this your first time? Oh, Michelle has used one before. Okay. Lori's first time. And Diane just put in the chat contacts for those state representatives you can contact. Oh, Michelle, sorry. Okay, it's your first time. Gotcha. And Shanice. So for a lot of you, it's the first time. This is awesome. I'm glad you're here today. And maybe you can share it with your coworkers or your leadership. All right. I think that, is there anyone, how about if there's anyone that's not done yet, will you post in the chat that you're not done so we can give you another minute or two? Otherwise, I think I'll move forward. And so everyone's got their average score, right? Okay, so great question. So each response answer was connected to a number. So if you answered never, that would be a 1. If you answered rarely, it'd be a 2. If you answered sometimes, it'd be a 3, often 4, always 5. So when you answered each question, you would have written down a number, and then you'll add up all of those numbers for all 23 questions. You get a total number, and then you divide that by 23. So you're basically just pulling the average of your responses. So you should get a number between 1 and 5 for your score. All right. I think I will go ahead and move us forward. So we've got our responses, and I'm going to actually stop sharing the tool and move us back to the PowerPoint. Okay. So again, the BAT is the core symptoms that we did just now are exhaustion, mental distancing, cognitive impairment, emotional impairment. So if you really wanted to, you could get into the different subscales where that burnout is most present. But today we're just going to talk about the total score. And again, later on, you could look at, or maybe you already did because you might have had more time, you could also look at your secondary symptoms of psychological distress and psychosomatic complaints. It looks like that's spelled wrong, so we'll fix that. Sorry. Okay, so here's the traffic light system. If your score was greater than or equal to 3.02, you're in the red, and it's likely that you're experiencing burnout. If you got yellow or orange, that means that your score was between 2.59 and 3.01. You're at risk of burnout. And if you got a green, which would be no burnout, that would be a score of less than or equal to 2.58. And I see some folks are putting their scores in the chat, and I want to take a look at that and see what folks are saying. So we've got 1.69, we've got 3.52, and we've got 2.74. So we've got a range. Thanks for folks who are sharing. So I want to talk to you all about that. What came up for you as you were completing the assessment? So folks can chime in over Slido. Again, if you'd like to verbally respond, you can do that by raising your hand to unmute. But what feelings came up or memories while you were completing the assessment? I know when I've done these in previous jobs, I started thinking about like all of the things that were stressing me out, specific situations I was dealing with certain clients. When I was doing homeless outreach, there was a lot of burnout in that job, and also like secondary traumatic stress, vicarious trauma. And again, that moral injury, the things that you can't provide those individuals, that's out of your control. So Bria is saying self-awareness and being in tune with bodily sensations. That's really great. That's like those body scans, right? That you can do if you really want to feel where you're feeling something in your body, where things are impacting you. Someone else is saying recognizing how often I experience emotional lability. Wait, I don't know if I'm reading that right. I think someone else is typing, but yeah, sometimes just giving yourself a minute to think about these things can really help you pinpoint how you've been feeling. Like maybe you've been so busy and overwhelmed, you haven't even had a minute to really like think about what you're going through. So it can be a nice time to just take a pause. So someone is saying they were wondering if they were having trouble staying focused or thinking clearly is due to work stress or something else, lack of sleep, vitamin deficiency. I've definitely gone through this. When I was doing homeless outreach, it wasn't necessarily trouble staying focused, but I was like irritable with my partner. And I was having that feeling of like, you guys, like when talking to friends who weren't doing that work, like you don't know what it's like doing this kind of job. Like you kind of get this weird attitude that other people could never know what you're going through. And also I was having like a lot of indigestion issues. And I realized it was due to the burnout. Of course, you should always talk to a medical provider or a mental health provider if you think it could be burnout or anything else, because you do want to make sure you're checking everything out appropriately by a professional. And then Lori's saying that they're more relaxed than they thought and not as stressed as they thought they were. So maybe you're going to get a positive reaction to filling this out. Like, oh, maybe it's not as bad as I thought. Thank you for putting the definition, because I've not heard emotional lability before. So rapid, often exaggerated changes in mood where strong emotions or feelings due to frustrations in the workplace. Thank you for putting that definition there. That's helpful. All right, next question for you all. How does it feel to see your burnout score? And some of you, it might be a repeat of what you just put, but it's a slightly different question. Did it confirm things you were already feeling or make you feel differently? Like someone was saying, oh, maybe I'm not as stressed out as I thought I was. Or it would be interesting to do the one, that looks at work related versus client related versus personal related burnout. Like maybe you'd find out, oh, it's actually my personal life and not work, or it's specifically clients and it has nothing to do with like my colleagues. Okay, Lori's saying much better than before. That's great. Prompting, someone is saying it's prompting them to take some steps to make sure they don't get into the red. So that's good. Like if you're in the yellow and it's possible there's burnout, but you're not quite in the red, you can take some actions to prevent you from going into the red. That's great. Teresa's saying better than I thought I would be. Okay, I'm glad for some of you. You're like happy to see that things maybe aren't as bad as you thought. Again, no stigma, no shame around experiencing burnout. It happens to all of us, and it's not about any personal um, problems on your end. It's about so many bigger issues than you. Um, so someone is saying comfort in a diagnosis and the ability to recognize why I've been feeling the way I have. And yeah, it can be really validating. You're like, okay, this evidence-based validated tool is telling me like there's a reason why I'm feeling this way. I do want to say again, like it's not technically a diagnosis and you would have to get that from a trained professional, but totally understand what you're saying. You can pinpoint why you've been feeling how you have. Someone else is saying confirm that I need to take more self-care actions. Great. And maybe also um, talk to leadership, talk to coworkers. And someone else was saying, Michelle, helped pinpoint how I feel. I've wondered about where I measure, and this helped me confirm where I am and better understand how I feel. I'm really glad that you all are getting something out of these tools. I don't know that everyone knows that they exist or how to find them or how to use them. So it's really cool that you're here, and hopefully you can keep using them and sharing them with your colleagues and your leadership. I'm going to move to the next question. Did any parts of your results surprise you? Maybe there were certain questions or parts of like a subscale you're like, oh, I didn't realize it was because of that, or I didn't realize this thing was impacting me so much. And if this feels a little redundant, we can skip to the next one because I'm not sure anyone's responding. Oh, we've got someone responding. Okay. Thank you for bearing with us too. This is a long time to sit and listen. Okay, so something that surprised Lori is that their sleeping pattern is off. Um, yeah, that's really good to know and something to definitely look into in your personal life outside of work, how you can fix that. Okay, I don't think anyone else is responding, so I'll jump to the next question. What aspects of your burnout would you like to learn more about? So, was there anything that came up in completing the assessment tool? You're like, oh, I want to look more into that, or maybe I want to do a different assessment that looks at this dimension of burnout more in depth. My cat is saying hello to everybody. I've been not giving her enough attention because I'm talking to you. Okay. I see someone's chiming in, so I'll give you a minute. Sabrina, any questions in the chat?
Not right now.
Okay. All right. So Michelle is saying the physical signs of burnout and how to spot it before it reaches burnout. Yeah, that's great. So there are there's the infographic that we developed, the signs and symptoms of burnout that I mentioned earlier on in the session. So that can be really helpful. You're like, oh, my back is hurting, or I've got really bad headaches. Like, and maybe it's not because you didn't eat or you've been hydrating fine, and like, but maybe that headache is stress induced. So sort of knowing what those signs and symptoms are, and then yeah, addressing it before it gets really bad and before like the physical and mental symptoms worsen. That's a great point, Michelle. Thank you for saying that. All right, I think I'm going to move us along because we also just have about 14 minutes left. So interpreting your burnout scores. Um, if you really get into it and you want to look at your scores within each dimension, you can see what areas, what dimensions of burnout are impacting you the most. And then again, that's going to let you know where you need to focus your coping strategies, or maybe the workplace policies or practices that need to be changed. And then in interpreting your scores, you can use some of the manuals that are available. So I think you saw when I was showing you each of the tools, like some of them have more information than others about what those scores mean, and really getting more in depth about how you can address the burnout. And I think, you know, something like the Maslow burnout inventory, they provide a lot of that reporting, but again, there is a fee associated with it. And then you can also use benchmarks. So like with the burnout assessment tool, we use cutoff scores, right? If your score is greater than or equal to this, your burnout is likely, or you probably have burnout, or you're doing okay. You're in an ideal place. Those are using cutoff scores. Another option to interpret your results is to look at benchmarks. So for the burnout assessment tool and other tools, they have like populations of clinicians and their scores. And so they're looking at like comparing your scores to everyone else in this population. So it's like using benchmark data for other, like if you would use it for, you would use it for blood pressure, right? For a patient, like how is their blood pressure comparing to benchmarks in our patient population, or like what's seen as like a good positive blood pressure, so a blood pressure that's in control. So you can do that for these scores as well. And then what you can do to explore your burnout even more is look at some of the assessment tools that include causes. Like I think I mentioned the Mini Z looks at causes. And then there are some companion tools available. So there's the Areas of Work Life Survey that's a companion to the Maslow Burnout Inventory. And there's also Generic Deep Dive for clinicians. It's a companion to the Mini Z. And I did want to show you a couple of those. Actually, we might be running out of time, so maybe I won't. But those are, these links are available in the slides, and you can look at them, but they really help you explore your experience of burnout even more so. And then also the infographic, Why Do Clinicians Experience Burnout? That's another infographic that we developed as part of this initiative that you can refer to and really think about what's causing that burnout. So you know how to address it within your organization. So another Slido for you all. How could you use burnout assessment tools in your organization to improve clinician wellness? So not just like using it for yourself to know where you like are scoring around your burnout level, but how could you use it like across like your whole organization or in your department? I see a few folks are typing, so sure we'll have some good responses in a minute. Thank you again for all your engagement today. It really makes it more fun for me and hopefully for you guys too. Okay, someone is saying it's helpful to know what each tool measures so that we're clear about the kind of information we will receive and how we will use it. Yeah, e- exactly. And then, if you're advocating to your leadership to implement some of these tools, you can let them know, here's what we've got, like, and maybe you have a team of folks you can talk to about which one's gonna, or which, not just one, maybe you'll use a few to look at burnout in your workforce. So Michelle is saying, I'm thinking of having a few surveys for different groups, which may lead to both group and individual interventions and support for those groups and individuals. That is awesome. I love that. So you're already thinking of how you're going to use them for different groups. I know when I was a homeless outreach worker, we would have what was called golden hour every week. And it was a time where the homeless outreach workers got together to maybe vent about the work, what's been frustrating, the burnout. And we sometimes did use these burnout assessment tools. And it was just a great place to start talking about why we're experiencing burnout and also like talking about how we want to go to leadership and talk about the issues we're experiencing to help make some changes. So I love that. And then, yeah, you can pinpoint different interventions for different people or groups. You might find like one clinic or department is experiencing more burnout than the other. And why is that? And so we can look at like the leadership or the practices or the structures of those different departments to see what might be causing that difference in burnout. And then Lori's saying, I would use in the different departments and engage in conversation about the results and their feelings or feedback. Yeah, exactly. And actually, I don't think I have time to show you, but for the Mini Z, they have some templates you can use for sharing results to leadership. So I would look into that. That can be really helpful for sharing those results. And then someone else is saying, we may use this tool in our provider meetings to measure burnout and how well interventions are working. That's also such a great idea. And I think, like I mentioned in the presentation, some of them are measure burnout over a certain time period. So it's possible you'd want to look into one of those where it's, within the last week or the last 30 days, whatever it is, so you can compare before and after interventions. Thank you all. This is really great. Loving all the feedback that you're providing. So some of you already answered this question, but are there any actions you'd want to take personally after completing the burnout assessment today, or what kind of support would you need to take those actions? And you could go ahead and respond if that's like personally or professionally. Or you don't have to share. At least maybe be thinking about it. I hope that it sounds like a lot of you are actually already thinking of what you want to do now that you've completed the tool and know more about all the options that are out there. But kind of like any action you want to take, like what resources do you need to implement that action, and what kind of support do you need to do that? All right, I think I see one person typing, so I'll wait a minute to go to the next slide. Don't want to miss anybody who wants to share. So Lori's saying, make sure I schedule personal time for myself. A good long bath. Yeah, I think that's great. I also do that when I'm feeling really stressed out. So it's like, yes, there are the organizational interventions that definitely need to happen, but like, what are you doing to manage your own symptoms outside of work or even at work? Some people will do breathing exercises like, oh, that interaction really stressed me out, or this like long-term stress that's occurring because of mismanagement, like I need to meditate, or I need to do some breathing exercises during lunch to like get me through the rest of the day. But yeah, taking personal time for yourself, maybe even going on a walk at lunch to help get you through the day. But yeah, a good long bath. That's great. All right, I'm going to move us along because I think we just have a few minutes left. So addressing burnout, discussing it at work. So some of you have already talked about how you can use these tools at work, but talking about burnout at team meetings, like again, let's reduce the stigma. Let's just open up the floodgates. Let's talk about it, because I'm sure once one person starts talking about it, a bunch of people will also be talking about it and expressing how they feel. Talking to your medical directors and clinic managers. Recommend regular evaluation of burnout. And again, some of you have already said you want to do that. Exploring the causes, including moral injury, because that's a big one. And then advocating for the workplace modifications. And again, like Sabrina mentioned, we'll have some webinars this summer about what those workplace modifications can look like. And here's an example of some of them. So scribes to help with EHR. The literature does show that scribes reduce the level of burnout experienced by clinicians. So that's a great one to start with. Ensure adequate time with patients. Limit hours worked per shift. Are people working like 16-hour shifts? Like that could definitely really exhaust folks. Allowing flexible work schedules, if that's going to help with your work-life balance. Fostering shared decision making, financially support professional development. The literature also shows that being able to participate in continuing education and also being mentors to like others and being part of professional organizations, that can really help with burnout, because you're like part of like a larger community and kind of getting outside of that clinical work. And then personal practices, again, you can refer back to our slides from previous webinar for more detail, but seeking medical or behavioral health treatment, of course, if your symptoms are really severe and you want to prevent them from worsening. Social support, friends, coworkers, positive reappraisal, which is like cognitively like reframing how you're thinking about situations, mindfulness, meditation, exercise, all these, stress relievers. Again, links to the infographic and the executive summary that I think we will post in the chat, and we have posted in the chat. And then I know we just have a couple minutes left, and actually we could go ahead and start the evaluation. We'll open that up for you all to fill out, but does anyone have any final questions or comments? Thanks, Sabrina.
Absolutely. If anybody wants to ask a question verbally, feel free to raise your hand and I will send you a request to unmute, or you can just include it in the chat.
We got some really great questions during the webinar, so appreciate that. And some hard questions, really, to answer.
We did. And while people are completing the poll, or if, thinking about any questions that they might want to ask, there is one question that came up in the registration that I think might be good to respond to. And it's for folks who are looking for their service sites and looking for a place that is a healthy place to work. What are some of those signs or some of the questions that they can ask during the interview process to make sure that they're going into a site that is going to be healthy for in terms of workload and personal work balance?
Yeah, that's a really great question, because of course you will be interviewing with different organizations and sites. And so it's great to ask in the interview process, do you have a chief wellness officer? Like, is clinician wellness a priority here? And tell me how it is. Like, is it in your strategic planning? Yeah, do you have dedicated staff working on it? Are you like regularly monitoring burnout? What is like the feedback loop or mechanism where clinicians can let leadership know how they're doing and what they think could be improved? Do clinicians have much say in like how the clinics are run and the services that are provided? So Yeah, I think that's great to do all that on the front end. And sometimes I don't know if it's possible to actually talk to people who are already working in those organizations. And it might be hard for them to answer those questions if they don't want to just say, bad things about what's going on. But some folks will be really honest and tell you what's going on. And also, if it's a really great place, hopefully they'll tell you too, like, oh, it's amazing. They listen to what we have to tell them. Leadership comes on rounds with us, so they see what we're facing, day to day. So that's another one, like making sure, like, does leadership go in rounds in the clinics? Do they actually know what's happening? And Diane, I see you turned your video on if you wanted to chime in.
I think you said all the things that I would have said, and I think that would be the best way to go about it in your interview. And you have that time to be at the site that you decide to interview with, and we will be happy to make sure that you get to that site and talk to them directly.
Thank you. I would say another one is like, flexible work hours and things like that. But I also realize it's a minute after, and so we want to be respectful of your time. And so I will let Sabrina close us out. Thank you, everyone.
Thank you so much, Molly, and thank you, Diane. This is a really great introduction to all of the assessment tools that are out there, a step that people often forget when wanting to address burnout within the organization is understanding which tool to use and really what are they measuring, because they all are different. I do want to remind you all that we will be sending you the PowerPoint slides. You can also access more information and other documents on our webinar registration page. The next webinar is measuring burnout at the organizational level, and that will be April 10th at 3 p.m. Eastern. And we encourage all NHSC students, clinicians, and leadership staff from NHSC approved sites to attend. So please be on the lookout for an email with more details and registration info, and we hope to see you then. Thank you so much, everyone.
Thank you.